We're going to move into some lower body work. What I would like, if you have sway back or flat back posture, I'd like you to grab that second to lightest loop band and bring it around your ankles. You're going to stay seated with it around your ankles. If you have Lordosis or Kyphotic Lordotic, you do not need this band. We don't want to over-recruit those posturally overactive hip flexors. Everybody, bring your hands to your hips. Plug your shoulders down your back. Try to pull your shoulder blades together and lift the chin. We're going to do some marching here. Everybody but flat back posture is going to point your feet as you march. Point your toes. If you have flat back posture, you're going to flex your feet to combat that plantar flexion in your ankles. So sway back is pointing, Lordosis and Kyphotic Lordotic, we're pointing our toes. Lift one thigh up, engaging the hip flexors and quadriceps, and then lower that leg down. Inhale to lift. Exhale to lower. Stay on the same side as your dominant arm. So that's going to be your right if you're right or your left if you're left. Stay on that side first, pointing the toes as you lower and lift that leg. Follow me if you want to follow a tempo or follow your own tempo if it feels better on your body. So inhale to lift, exhale to lower. And you'll notice the front of the thigh around the groin, that's where you should be feeling a burn. Maybe the top of the thigh, but most likely those hip flexors are what's grabbing if you have that band on. If you don't have the band on, I'm hoping that you're grounding that pelvis down and you're using more abs than anything to lift up so that we can start to build up that abdomen that is not working as efficiently as it should. Keep breathing here. So let's switch to the other side now if you haven't. If you've been alternating, that's great for the abs, so keep going with that. If you haven't switched, go ahead and switch sides. Sitting up tall on the top of the sits bones, taking it up, holding it up, and lowering it down. It's important that you inhale to lift because I want you to think about using your low abs to control it as it goes down. And your exhale is when you're doing that Ujjayi breath, where you've pulled your belly in towards your spine. So that's actually where you get the abdominal contraction and the control and you build the strength. Okay, from here, we're going to add a little twist. Bring your hands behind your head, interlacing them behind the head. Open the elbows out to the side. You can lean the head back like your hands are a hammock. Plug your shoulders down. We're going to add a lift of the same knee on the same side as your dominant arm first, and I want you to twist towards the knee you're lifting. So twist, but keep the torso lifted. So still keep your focus of your eyes up a little higher than eye level, and twist from your rib cage towards that knee, plugging the shoulders down. So we inhale, twist, exhale, lower. Inhale, twist, exhale, lower. You're doing great. Stay with it. Sitting up taller with each inhale, bracing the abs, pulling back with the inner thighs, and I mean back towards the wall behind you to get you seated on the top of the sits bones. It's easy to slouch when you're in a chair. So we're going to combat that with a deep lift of our pelvic floor. One more on this side. Okay, switch the twist and switch the leg. If you need to roll your shoulders out or do a few neck circles because you're fatiguing, take that time for yourself, and let's begin the other side when you're ready. Watch out for the upper body rounding forward. Don't let those arms pull your upper body forward. Think about your head resting back into the hands and the twisting happening from your rib cage. So the rib cage is twisting around. And that way we get a little more recruitment in the obliques. Pull your abs in as you come up and keep them lifted in and up as you lower down. Just 15 seconds left here. Make each one count. Going slow, bracing the abs. Hear that ocean breath like you're fogging a mirror on your exhales. And I like to tell women, nobody wants to get wrinkles around their lips, so don't pucker your lips. You don't have to. You can just keep your lips relaxed as you exhale and let it go there. All right, enough is enough. Let's make our way to a wall for an assisted quadricep stretch. Your quads are the front of your thighs. We're going to use our chair, and we'll hold on to a wall. We'll be able to take our foot onto that chair like so, And once it's on that chair, we can push the pelvis forward. So the top of the foot rests on the chair, and we can push the pelvis forward. This is a nice, gentle way. So the top of the foot's on a chair. You can have a hand on a wall for balance and push your pelvis forward. Gonna hold it here, breathing into this nice quadricep stretch. After all those marches, our quads should be very worked and ready for a stretch. Make sure as you're doing this stretch, your shoulders are down your back, your collarbone is wide, your chin is lifted. Keep breathing. So from here, I'd like you to switch sides, setting up on the other side, taking your time, no rush. Now, if you're holding a wall, make sure you're not sticking your butt back towards the chair. I want you to pull your abs in and try to do a little tuck of the pelvis here, because that's going to intensify the stretch in the front of the quadricep. Watch out for your standing knee locking. Don't bow in or out in the knee. Keep the knee soft. Equal pressure through the inner and outer edge of the foot. If you're standing leg, you'll feel a little burn in the outer hip. Great way to build up your glute med, your outer hips, just doing this standing quad stretch. We just have another 15 seconds here. Hang on. Use that ujjayi breath. No pursing of the lips. Collarbone wide. Lift that chest up. Stay proud. Stay strong. Breathe here. Great. From here, there's two variations. If you have sway back or flat back posture, go ahead and take that second to lightest band around your ankles. And our KLP and LP, you're going to do the same thing. The exercise is different, but we all have our second to lightest band around our ankles. So with the band around our ankles, if you have sway back or flat back, you're going to lift your leg to knee flexion. And I want you to come over to a wall. So this is just like our marching seated. We're going to take our leg up to knee flexion. If you have kyphotic, lordotic, or lordosis, you're going to do a hamstring curl. So knee flexion for sway back and flat back, and hamstring curl for lordosis and KLP. So we're going to take that leg up and hold it. Start with the same leg as your non-dominant arm. So start on the non-dominant arm side of the body. And so you're standing, holding onto the wall like it's a bar, and you're going to lift the outside leg up to knee flexion with the loop band around the ankles. If you have KLP or LP, it's kicking behind you into hamstring curl. Everybody point your toes except flat back posture, you're dorsiflexing. So take it up and lower it down. Inhale, lift. Exhale, lower. And as far as your pelvis goes, if you have flat back or sway back, tip your tailbone back. Try to arch your low back here. Pull your abs in as you do that. I don't want your hips hiking. Your outer hand can be on your hip. If you have KLP or LP, tuck your pelvis under and show me that hamstring curl with pelvic flexion. Keep your low abs in. Focus on the quality of the movement here. We only have 15 seconds to go on this side. Keep your low abs in. Don't let them pooch out. Think about the rib cage, the front ribs, soften them in. Plug your shoulders down. Switch sides now. Setting up in the other side, remembering the pelvic position and how important it is for your back safety. So arch your back if you have sway back, or flat back, and tuck the pelvis under if you have lordosis or kyphotic lordotic. Begin your hamstring curls or your knee flexion, depending on your posture. So outer hand on the hip, pull your shoulder blades together, lift your chin up, gaze is a little higher than eye level, and use your breath. Inhale to lift, exhale to lower. And if you're going at a tempo that's up and down, see if you can slow that down. Take maybe 4 counts to lift and 4 counts to lower. Think of your favorite ballad right now and sing it to yourself and go slower, slow down. Take your time. Give me 2 more. Great job.